Your children are precious, and when they're not feeling well, you want the very best care possible. That's why families choose a team they can trust, a staff that welcomes them with compassion, and providers dedicated to helping children feel their best. When we say healthcare for everyone, we mean every child deserves access to quality, compassionate care close to home. At Gateway Pediatrics, we are proud to care for the children and families of our community with the attention, trust, and support they deserve. Gateway Pediatrics, to provide quality healthcare for everyone.
Well, welcome to this installment of Gateway Today. I'm your host, David Vasquez, and Gateway Today is that show that talks about all things Gateway Community Health Center. And today's a very special show, ladies and gentlemen, because I'm getting very personal about my colonoscopy. I'm sharing my personal journey with each and every one of you to hopefully let everyone know that screening for colon cancer has become a priority, if not mandatory for all men over the age of 45. And since I turned 45 years old, I thought it would be proper that we share this journey with you to hopefully change some lives out there and save some lives while we're in the process. First up, we'll get a chance to talk to our Chief Medical Officer, Dr. Mery Cortez, who will tell us the importance of getting screened and getting referred to the gastroenterologist to get the colonoscopy done in the first place. Once we're done talking to Dr. Cortez, we'll get a chance to actually walk through step by step of what it takes to get prepared for the actual colonoscopy itself. Finally, we'll get a chance to sit down with the gastroenterologist serving all of South Texas. I'm talking about none other than Dr. Alfredo Camero, who will actually perform the procedure and share what we can do to prevent more colon cancer from happening within our demographic. We got a lot of show to cover. It's a personal experience that I'm excited to share with all of you. My journey to a colonoscopy. So sit back, relax, kick your feet up, because another installment of Gateway Today starts now. Well, welcome to this installment of Gateway Today. Well, it's a personal experience to getting my colonoscopy done that I'm going to share with all of you. But the first person I need to talk to is my very own primary care provider to get me that referral to go see the gastroenterologist. So first up, we talk to our very own Chief Medical Officer, Dr. Mery Cortez. Check it out. All right, ladies and gentlemen, well, we are here with our Chief Medical Officer, Dr. Mery Cortez, who has joined us on the program, a favorite and familiar face of Gateway Today. And Dr. Cortez, thanks for being here. We wanted to start talking about colonoscopies, colon cancer, screening for these cancers, right? And so I wanted to bring you in to ask you about that, Doctora, and just kind of tell me a little bit about sort of what you're seeing right now as you're visiting with patients. What you know, off camera, we talked about this before, but you've told me that these cases in the colon cancer cases are on the rise, right?
Yes, definitely. Thank you for the invitation. Definitely, we're seeing a higher amount of cases of colon cancer, but definitely we can prevent the advanced cancer, right? If we start screening early these patients.
Yeah, and that's the key that we want to send to everybody, that message about screening, right? It all starts with screening, and that screening, there's different ways to do that. So tell me about that. As the earlier we can screen and the earlier we can detect these cancers, there's a better chance of beating the cancer altogether, right?
Well, yes. We started the screening by the age of 45. Before it was at the age of 50. Recent research has shown that we should start screening earlier at 45, or unless you have family history, we start screening earlier than that, depending on the age of your family member when they got detected with cancer. So if we catch the cancer earlier, the treatment, the resources, everything should be easier to treat for the patient.
And let me ask you, so I come in, I visit with you, and what is that like telltale sign that I should get screened? Or is it, how do you know as a physician that, hey, this is that time?
Well, the age. Right now is the age. So what we do is that we should be doing the annual wellness visit for all the patients and see where they're at with their screenings, with their health, and right? And that's when we recommend, oh, you're 45, you're about to be 45, so let's start with the screening. Screening is, we don't have to have any symptoms, right? There's no disease, there's no symptoms. So it's trying to catch any lesions before it becomes cancer or before it becomes symptomatic, right?
Okay, so tell me about the screening itself. There's a couple of different ways we can screen.
Yes.
Obviously, colonoscopy being the gold standard, but there's other screenings, right?
Yeah, so we have options, right? There's one that is a stool test that would check for blood in the stool. And that's like an early sign of any lesions being in the colon. If that's positive, you have to do a colonoscopy, right? Like, so to look for the lesion. The other option is the Cologuard, that is DNA testing, and they check for blood as well. And that's like, you can do that test at home. It doesn't require any prep. The lab sends you the box, and you collect the stools there, the samples, seal everything, send the box back, and they send you the sticker, and you send the box back to the lab, and they give us the results. If that's negative, it's good for 3 years. If that's positive, you have to do a colonoscopy.
Okay, and for those wondering, well, does my insurance cover this? What are the coverages, or even for those that don't have insurance?
Yeah.
What does that process look like?
Yeah, we have options, right? If you don't have insurance, we have a program that is supported by CPRIT and MD Anderson in Houston. So we do the ColoFit, that is a stool test for blood. And if that's positive, that program covers the appointment with the gastroenterologist, the first appointment, the colonoscopy, and the follow-up for those patients without insurance.
So for those with insurance, most times by the age of 45, all of this stuff is covered, correct?
Yes, because it's a screening test.
Awesome. And so I guess that's the message that I wanted to convey to everybody watching, is that there's really no reason that you shouldn't start screening, right? Because of that screening. How important, Doctora, just in your personal opinion, and since you've been seeing all of this kind of sort of creep up on us here within South Texas, how important is that screening?
Highly important, right? You don't have to have any symptoms. You're not gonna to screen, right? You shouldn't have any symptoms. And when they do the colonoscopy, there's a lesion, a precancerous lesion, they remove it, and then they follow up with you in 3, 7, or 10 years, depending on the findings. But it's a great thing, and you can have a peace of mind that everything is good with your health.
Awesome. Well, we appreciate your insight. It's huge as I get ready to document my journey on to taking my own colonoscopy as I've reached that age. Dr. Cortez has now referred me to the gastroenterologist, and we're going to take you through all of that. But Dr. Cortez, we really wanted to just thank you for, and just letting folks know that screening is critical to making sure we catch these cancers early. So thank you for your time.
No, my pleasure.
And thank you all for watching this installment of Gateway Today.
Bye.
Hey, our thanks goes out to our Chief Medical Officer, Dr. Mery J. Cortez, who has given me my referral to get my colonoscopy done. I thought it would be important to document the process of getting prepared for the procedure. So follow me as we get set to get the colonoscopy done. Check it out. So it's about 10 a.m. Good morning. I am going to run you through the process of getting prepared for my colonoscopy, and thought it would be important to share some of the prep that needs to go into place before you actually take the examination. And so I'm excited to walk you through this journey. Can't show you everything, but I'm excited to share and document this process to show you what I think will be kind of an easy way of getting this examination done so that we remove any doubt, any fear. So it starts off with a couple of pills that I'll need to start with. It's 10 a.m. I'll start with these pills, and then we'll take some more medication as we go throughout the day. The recommendation, of course, is that we stay hydrated, so we'll be drinking a lot of water and steer clear of any kind of certain liquids that are recommended that you do not ingest while you're prepping for your colonoscopy. I've had my big breakfast this morning, so that's the last major meal before our prep begins, and we're going to start that right now and guide you through the rest of the process. And so here we go. Cheers. We'll see you on the other side. All right, so it is now 6 o'clock, and we are about to take our next solution. We're going to do one of these right now at 6 o'clock, dilute it with 16 ounces of water. And then we will take the second solution at 3 o'clock in the morning, and we'll give you an update. All right, so it's just a little after 3 a.m. And we're taking our last solution before our colonoscopy. We'll see you in a few and head out to go take our test. So I just finished the last solution of medication, and I'm not gonna lie, that one was a little harder to take at 3 a.m. The flavors are a little tough, but it's all gonna be worth it. I'm not gonna say this process isn't easy, but it's totally worth it. And now we are ready. We are going to drink the rest of our water. We will need to drink about 32 more ounces of water. And we will need to finish this at least 2 hours before our procedure. So we're going to do that and head over to the examination room here shortly. All right, so we are getting ready to go into our procedure. It's about 7 a.m. and we will let you know how it goes. We'll show you a little bit of what the inside of the colon looks like, and then we'll sit down and get a chance to talk to Dr. Alfredo Camero, our gastroenterologist here, who's going to be doing our procedure. So we'll see you on the other side.
Well, you've seen what it takes to get prepared for a colonoscopy. Not too hard. It's actually a pretty simple process. But next, we will show you what happens when you get to the operating room and even show you the inside of my colon. It's a super personal experience that you don't want to miss. More Gateway Today on the way.
Your children are precious, and when they're not feeling well, you want the very best care possible. That's why families choose a team they can trust, a staff that welcomes them with compassion, and providers dedicated to helping children feel their best. When we say healthcare for everyone, we mean every child deserves access to quality, compassionate care close to home. At Gateway Pediatrics, we are proud to care for the children and families of our community with the attention, trust, and support they deserve. Gateway Pediatrics, to provide quality healthcare for everyone.
Well, welcome back to Gateway Today. Before the break, we said we were headed over to the operating room with Dr. Alfredo Camero, our gastroenterologist, to get my colonoscopy done and share it with all of you. We do want to warn viewers that discretion is advised. This is raw and real surgical footage of the inside of my colon, and it is used for educational purposes only. Check it out.
All right, ladies and gentlemen, we are inside the, actually in the procedure room, about to get the colonoscopy done. I've been mic'd up, if you will, ready to go, so they can administer the anesthesia, and then Dr. Camero will do his thing, and we will share that journey with you. Thanks for watching. Cheers. gentlemen, so the colonoscopy is now complete. Big shout out to Dr. Alfredo Camero here with the gastroenterology consultants of Laredo, who provided the procedure. Seamless, easy. I'm gonna be completely honest. I'm a little groggy after coming out, so definitely the recommendation is to, obviously I'm ready to eat, but get some rest, and then things will be all good. And then we will talk about what Dr. Camero found, along with a sit-down interview with Dr. Camero. Thanks for watching.
Well, not too bad of a procedure because I didn't feel a thing. As a matter of fact, I was asleep the entire time and came to by Dr. Alfredo Camero, who has my results. And so we're gonna share those results of my colonoscopy with you as we get a chance to sit down with our gastroenterologist, Dr. Alfredo Camero. Check it out. Well, we are here at the Gastroenterology Consultants of Laredo, sitting with our very own gastroenterologist right here in Laredo, Dr. Alfredo Camero Jr., who is joining us on the program. Excited to sit down with Dr. Camero. It's been a long time in the making, Doc. Took me 45 years to actually sit down with you.
Yes.
But Doc, I think we just want to get right to it. I mean, obviously, let folks know, what does a gastroenterologist do, and
Sure.
what you really specialize in?
Yeah, so gastroenterology is a subspecialty of internal medicine. We focus on diseases and disorders of the GI tract, so think stomach, small intestine, colon. In that area, we also manage diseases of the liver and pancreas. Within that, the fact that, or the reason that you're here is to discuss colon cancer screening. One of the big parts of my job is to perform screening colonoscopy to prevent and also diagnose early cases of colon cancer.
Yeah, and I think that was the important reason we wanted to sit down with Dr. Camero, was really to discuss that very thing, colon cancer, which is impacting men and women at a younger age. Before, it used to be 50, right? Now they've dropped it down. The American Cancer Society, or American Cancer Association, has kind of downgraded it to 45, right?
So there's a few big organizations that make these decisions based off of data that's available on when to screen patients for preventable cancers, including colon cancer. And so the American College of Gastroenterology, the American Cancer Society, and then also the American College of Physicians all got together. They reviewed the data that was concerning over the last 10, 15 years, that we were seeing younger and younger folks getting colon cancer. And so running their models and cost projections and all that, they decided to lower the screening age from 50 years old to 45 years old, with the goal of catching more cases of these younger folks being diagnosed with colon cancer.
So now that we're sort of downgrading that age from 50 to 45, we're starting to even see it at an even younger age, right, Doc?
Yeah, if you have seen the headlines, New York Times, CNN, Fox News, they've all at one point or another over the last year released an article about the concerning rates that are increasing of colon cancer in younger individuals. And it's a real thing. We see it on the ground as well here in Laredo. I was mentioning to you before we started filming that I diagnosed, unfortunately, a patient with colon cancer last week who's 23 years old. That is by far the youngest patient that I've ever diagnosed with a colon cancer. But I have seen in my 7-year career up until this point, patients in their 30s and early 40s being diagnosed with colon cancer. I had one the week prior that was 45, 46, also here for his first time colonoscopy. So yes, we are seeing younger individuals get diagnosed with colon cancer. Us as a gastroenterology society, we're very pleased when they lowered the screening age from 50 to 45, knowing that it's still not even perfect. We're not going to catch everybody and prevent every colon cancer. Like I mentioned to you, the 23-year-old, the 35-year-old, those folks would not have made it to the 45-year-old threshold to get checked, but we're still catching other patients in time. Last thing I'll say on this topic is, colonoscopy, although the gold standard, is not the only screening test available for colon cancer. There are some stool-based tests. And so for the folks that I do end up meeting are encountering that are concerned about performing a colonoscopy because of our cultural issues as Hispanics, men particularly tend to really want to avoid getting that procedure done. I tell them, well, better something than nothing. And so getting a stool test, which could indicate something brewing in there if it's positive, which would then lead us to still get a colonoscopy afterwards, but maybe would have a better, reason to convince these folks to get it at that point.
And that would be the Cologuard, right? Or the stool test.
There's a few out there. Cologuard is one of them.
The most popular, probably.
That is a popular one because it's very well marketed.
Right.
And that's why it's so popular. There's one other one called the FIT test that's actually cheaper and honestly probably a little more effective. It just doesn't have the same marketing as Cologuard, but both are pretty equal to each other. They test for different things. At the end of the day, getting any of those versus nothing is better. Colonoscopy and all those two stool tests are all very good at detecting colon cancer and excluding colon cancer. What the stool tests are not good at are detecting polyps or excluding polyps. And so question may be, well, what is a polyp, right? Polyp is how colon cancer starts. It's a small growth on the lining of the colon. And, it starts off as a polyp. 15 years later, it turns into a colon cancer in some cases, right? And so the colonoscopy, the actual procedure where we're visualizing can find those. And not only can we find them, we can remove them during the time of the colonoscopy, thus preventing colon cancer from happening. Stool tests are not good at picking those up. And so that's where colonoscopy really takes a big leap ahead on why it's more effective and why it's considered the gold standard.
Because you get right in there, right? I have so many more questions, but we really do need to take a break, and then we're going to come back with Dr. Camero to talk a little bit more about colonoscopy, my colonoscopy specifically, and what you can do to stay safe and continue to prevent colon cancer before it turns into something deadly. That said, we're coming back. So more Gateway Today on the way. Stay close.
Your children are precious, and when they're not feeling well, you want the very best care possible. That's why families choose a team they can trust, a staff that welcomes them with compassion, and providers dedicated to helping children feel their best. When we say healthcare for everyone, we mean every child deserves access to quality, compassionate care close to home. At Gateway Pediatrics, we are proud to care for the children and families of our community with the attention, trust, and support they deserve. Gateway Pediatrics, to provide quality healthcare for everyone.
All right, welcome back. We are here with Dr. Alfredo Camero Jr. He is our gastroenterologist who we've been talking to here with the Gastroenterology Consultants of Laredo. Dr. Camero, before the break, we were talking about early detection. I really just want to talk really briefly about preventative care, what we do at Gateway, right? So it's important for folks to get that referral, depending on insurance, right? Because if you have certain insurance, they can come right to you. But if they're going to see their primary care physician, they can refer them to you, right? If they're having any kind of gastro issues, right?
Absolutely, yeah. I mean, we see a lot of referrals from patients with symptoms, and then we see a lot of referrals from patients without any symptoms that just need to get screened for colon cancer because they reach the age of 45 or above. And of course, insurances, they can be messy. That's where a great organization like Gateway can help direct their patients and decide whether they need an actual referral first. Usually those are the HMO plans versus the PPO plans where the client that has an insurance can go anywhere, if you will. And yes, those folks can just call us directly to the front desk and we can set them up with an appointment.
Yeah, and just full disclosure for anybody watching, Gateway does also have programs to cover these procedures for those that are uninsured as well. And as we sort of start diving into the colonoscopy process, I thought it was important that I would share my journey through it. And so I want to talk to folks about my personal journey and what you saw, because obviously before this sit-down interview, we documented that process and what it would be like. Tell me just what that process was, or what you called it, a boring procedure.
Yes, and so I have his permission to share details about his procedure, and I think you're going to air it on the episode. It was a very boring procedure in the best way that I can say that. In medicine, you don't ever want to be the interesting case, and so your case was very boring and mundane, which is a good thing. I didn't find any polyps. There was obviously no colon cancer for us to discuss, and so it was a normal colonoscopy. Our rates here in Laredo locally, we are finding polyps, or God forbid a colon cancer, more likely polyps, in 60% of the colonoscopies that we do for patients without any symptoms, screening colonoscopies. 40% will be like you, boring, without any polyps. And so I like to tell patients that when they wake up. It's a little humorous, and just so that they can understand that that's a good thing, that we didn't find any polyps in their colonoscopy.
Well, and yeah, I mean, I'll take boring all day long, right? I'm happy about that. But let's just say you were to find some polyps during the procedure. You actually remove them during the procedure, right?
Yes, exactly. Okay. It's an all-inclusive, process. And so we remove the polyps there during the procedure. We'll send them off to get analyzed to a lab, and they'll give us the result. Usually by the time of just looking at the polyp, we can already guess what it's going to be, but we confirm it at the laboratory.
I hope you got a great deal of information from Dr. Camero. He's an excellent physician here in our community.
Thank you.
And the message today is really that you get screened. If you're 45, if you have that special man, special woman, or 45 and older in your life, or maybe you're younger and you're experiencing these symptoms of pain or issues with your digestive tract, get over to Gateway, see your primary care physician so that you can get a referral or start making those phone calls, but do not wait till it's too late. And so he is our gastroenterologist, adored across Laredo here in South Texas. His name is Dr. Alfredo Camero Jr. on the program with us today. Dr. Camero, thank you so much.
Thank you. Appreciate it.
Well, it's been a deeply personal experience that I've been happy to share with all of you, but I do want to issue the challenge to all men and women ages 45 and older to start getting screened for colon cancer. It starts by talking to your primary care provider or your gastroenterologist to start talking about screening. Remember, most insurances cover colonoscopies 100% after the age of 45. If not, programs are in place to help you cover the cost of the procedure. If you need more information about getting screened, make sure you head over to our website, gatewaychc.com, or call 956-795-8100 to visit with us here at Gateway Community Health Center. Remember, Gateway turns no one away. Everyone is accepted as a patient. We accept most insurances, Medicare and Medicaid, and even those without insurance. If you want to catch a full rewind of this episode or any of our other Gateway Today episodes, make sure you head over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. Till next time, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Your children are precious, and when they're not feeling well, you want the very best care possible. That's why families choose a team they can trust, a staff that welcomes them with compassion, and providers dedicated to helping children feel their best. When we say healthcare for everyone, we mean every child deserves access to quality, compassionate care close to home. At Gateway Pediatrics, we are proud to care for the children and families of our community with the attention, trust, and support they deserve. Gateway Pediatrics, to provide quality healthcare for everyone.